Hello again, it's Mayor John Hamilton sharing a little information with fellow city employees. I hope you're all doing well. This is Thursday, April 30th. Hard to believe we're at the end of April. In some ways it seems like we've been in a different world for months, though it's only been about 6 weeks as we've really hunkered down and dealt with the coronavirus and COVID. And thank you again for all you're doing. I know it's challenging at the workplace, at home, in the community. Your service makes the community work, and I can't thank you enough for that. But I will express on behalf of all of the residents of Bloomington, thank you for what you're doing. I've been in quarantine at home, as many of you know. I had two members of my immediate family here who were diagnosed with COVID, and Dawn, my wife, at the hospital for 11 days. I've been tested twice, and both are negative, even though I've been a little under the weather, but I'm glad to be able to get out of the quarantine soon, it looks like. I want to share with you some thoughts. We don't yet know what the governor is going to do. Tomorrow may well be Friday, May 1st, some statements about how the state will continue or adjust the stay-at-home order. That obviously affects us a lot. I'm working regularly with our county counterparts and health counterparts and IU leadership to talk locally about what we're going to do. We know in the weeks ahead and months ahead we're going to be evolving, we're going to be changing. We have done a good job locally of flattening the curve, protecting our healthcare system. Thanks for being part of that. We've been able to make sure so far we haven't had a surge that challenged the ability of our healthcare system to respond, so that's really good work. As we look at how we evolve in the weeks and months ahead, we're going to be looking at how that changes. Part of that's going to come at the state level, but very much locally we're also trying to evaluate how do we open up, if you will, and change. That includes city government. We're starting to explore when, whether, how to open up facilities like City Hall, like the Downtown Transit Center, like fire stations, police stations, other locales where we're currently closed. How will we open those up? How will we continue to work? Will we, what's the balance between those who are teleworking and those who are working on site? How will that change? And I know this is going to be more change in the midst of already challenging change and can cause some apprehension. So we're working very closely with department heads who I know are talking to all of our employees about various choices we'll have to make. We won't do anything precipitously, but we also know we're going to be evolving back into some different ways of doing business than we have been over the last several weeks. So we're monitoring what's coming out of the state. That affects what we do, but we're also working very closely here locally to determine what it is we want to do, step by step, both inside government and then all the private sector, from bars to restaurants to hair salons. I need a haircut. Many of you do, I'm sure, to other service providers. How is that going to change? And so stay tuned to that. Keep doing what you are doing. We're going to continue to see physical distancing, the using of masks, of course staying home if you're sick or you have a reason to be in quarantine or isolation due to other people that you've been in contact with being sick. I'm pleased that we've not had, beyond the 2 individuals in city employment who were tested positive a number of weeks ago, we haven't had another one. That's been terrific, and I hope we can continue that record. Thanks again for all you're doing. Please reach out to your department head, to my office. You know there's counseling available if you want it, directly about COVID or otherwise. Continue to take care of yourself as you should, and continue to take care of Bloomington. We'll keep plugging, we'll get through this. We're going to be seeing changes in the weeks ahead, and we'll be communicating about that regularly. Take care of yourself again, and take care of Bloomington. Thanks so much for all that you're doing.